So after talking in detail about our lecture topic, Meniere's disease, now we will talk about the treatment of Meniere's disease. In the treatment, we will talk about how we can manage the acute and chronic attack of Meniere's disease. And then acute and chronic, we should know the difference between acute is sudden onset and chronic is the condition that is present for long duration of time. So acute Meniere's disease and chronic Meniere condition and attacks, how we can treat them. Then we will also talk about intratympanic gentamicin therapy. Gentamicin is an antibiotic which can be given intratympanically to treat the Meniere's disease, and also what's the microvic treatment. And then we will talk about what are the different surgical options for the treatment of Meniere's disease. So treatment is, we should do first, reassurance is very important. This is a troubling condition. Patient is in trouble, they have different conditions like symptoms like vertigo, they have tinnitus, they have hearing loss. So patient is really worried because they are affecting the patient's daily life. So reassurance is important to tell the patient you will feel better, this can be treated, all that reassurance is important. Then cessation of smoking. If patient is smoker, they should quit the smoking. Low salt diet is important. Salt causes retention of fluid and causes retention of water and fluid. So it should be low salt diet is important. Avoid excessive intake of water. And then also avoid indulgence, overindulgence, too much coffee, tea, and alcohol. If somebody is taking 5 cups or 4 cups a day, they should have it, and then slowly overindulgence should be avoided. Avoid stress and bring a change in lifestyle. That's also important. Bring a change in lifestyle, exercising, dietary habits, all that daily routine activity should be improved or changed. Avoid activities requiring good body balance. So balance is disturbed in this, so avoid the activities requiring good body balance because patient can fall or hurt themselves. Management of acute attack, reassurance and psychological support. Bed rest with head supported on pillows. Head should be little elevated to reduce that pressure or fullness in the ear. So bed rest with head supported on pillows. Head elevation. Vestibular sedatives are used. Then vasodilators are used that can cause dilations and increased flow. Better flow should be important, like inhalation of carbogen and histamine drip. Management of chronic phase is vestibular sedatives again. Vasodilators, the same as we used in the acute attack. Then diuretics. Diuretics are the drugs that are used to lower the body fluid volume. These drugs are also used for patients who have hypertension, and they are also known as the water pills. So they decrease the fluid in the body by increasing the urine outflow. Propanthenol bromide, and then elimination of allergens. If the Meniere's is because of allergies, removal of allergens is important to prevent the future attacks. hormones can be used. Then intratympanic gentamicin therapy. This is given by the injection in the tympanic membrane, as the name show, intratympanic, in the tympanic membrane. And chemical, this is known as chemical labyrinthectomy. Chemical labyrinthectomy, ectomy is the removal. So in this, labyrinth is removed chemically. Vestibulotoxic, absorb through the round window and cause destruction of vestibular labyrinth. So it's the vestibulotoxic, and it can cause destruction of the vestibular labyrinth, and this can cure the symptoms of Meniere's disease, and this is absorbed through round window and cause destruction of the vestibular labyrinth. Gentamicin is a drug that is in the aminoglycoside classification, and aminoglycosides are the antibiotics that are not safe for the ear. They are ototoxic, so that's why it can cause vestibulotoxicity and cause destruction of the vestibular labyrinth. Microvic is the another procedure in which small vic made up of polyvinyl acetate. These are the small vics, and deliver drug from external canal to the inner ear. So microvics are made up of polyvinyl acetate, and they transfer the drug or deliver the drug from external to the inner ear. Requires a tympanostomy tube. A tympanostomy tube is inserted, and then through that tube the microvic goes and it carries the medicine from the external ear to the inner ear. Surgical treatment is conservative procedures. Usually decompression of endolymphatic sac is performed, decompression is done, and then endolymphatic shunt operation. Shunt is outlet is produced, or shunt is created that can remove the fluid from the endolymphatic system or sacs. Saculotomy, again, sacule and utricle are structures present in the vestibule. So saculotomy, otomy is opening. So sacule is open, and procedures to relieve the pressure, saculotomy. Then we have another surgical treatment, which is the destructive procedure. One was conservative procedure, then we have destructive procedures. In this, the labyrinthectomy is performed, in which the labyrinth is removed. This is the sacule and utricle. We have removed soft parts, fill inner ear with gentamicin. And then we have removed semicircular canal ampullae. So labyrinthectomy is performed. Then another surgical treatment is intermittent low pressure pulse therapy. Intermittent low pressure pulse therapy, in which the pressure waves pass through ventilation tube to round window membrane. This is the pressure waves pass, and then what they do, these pressure waves transmitted to perilymph. This is the perilymph surrounding the area of the membranous endolymph. And then from there, it redistributes endolymph pressure to sac, and then finally redistribute endolymph pressure to blood vessels. So low pressure therapy is given, in which low pressure is inserted, and then that low pressure is transmitted to perilymph, and then perilymph is surrounding the endolymphatic system, so pressure is redistributed in the endolymphatic system. So all these are the different treatment options that can be tried for the treatment of Meniere's disease. So that was all about our lecture topic, Meniere's disease, in which we talked in detail about the causes, pathology, tests, investigations, and the management of the Meniere's disease. So thank you for watching sqadia.com.